to get into the anatomy of it here is we have three joints at each bony level. Now each bone is called a vertebra, and in between each vertebra is a cartilage known as the intervertebral disc. And the disc job is to hold each vertebra on a specific center line. And the reason why the center line is so important is that at each vertebra we essentially have three joints. We have an anterior joint where the disc is attached, and then we have two posterior joints on the backside called facets. So each spinal level is like a tripod stacked on top of another tripod. And this is an important concept to understand because the movement pattern through the spine is something known as or regarded as coupled motion. And this is a very important concept. Even though the spine is made up of 24 different bones, each bone with three joints that interact with the bone above and below it, as a unit, the spine has to function as one. So the way that happens is through a motion pattern called coupled motion. And in a nutshell, what coupled motion means is that in order for a person to turn their neck 90 degrees to either side, they're going to get a few degrees of movement at each level of the spine all the way down through the lumbar, actually down to the sacrum. So each movement is integrated or coupled together with each bone. So all movement in the spine affects the entire spine. Movement in the lower spine or the lumbar area affects the mid-back and the neck. Movement in the neck affects the mid-back and the lumbar area. All movement is coupled together. So now that we understand just a little bit about the mechanics of how spinal function happens, we're going to talk about two of the main causes or main symptoms of pain that people experience when they injure or hurt their back. So a true injury would be some type of a sprain, or maybe even a fracture to the bone. But a lot of time pain happens just from simple movements. One of the most common things I hear is that somebody bent over to pick something up and all of a sudden they had excruciating pain. When they came back up, they felt burning pain going down the back of their leg. That is usually the sign of a disc injury. So taking a cross-sectional view looking down at the top of L3, we're going to get a representation of what that looks like. So here we have the body where the disc is attached. Here we have the posterior part of the spine with the two facets. Okay, there's our tripod joint complex. Okay, so anytime we injure the disc bulges out to the side. And the reason why it does it is here in the center of the disc is we have a gelatinous core. The core of the disc is kind of like our Nike air pillow in the heel of our shoe. That's what gives us all of our shock absorption and our cushion. That jello or gelatinous material is encased in rings of cartilage. And the reason why the cartilage is in rings is so that it can move rather freely without tearing. The problem is that over years and years and years of wear and tear, this cartilage is going to break down. It breaks down in a way to where cracks and fissures start to form, and as those cracks and fissures in the center start to form, that gelatinous centerpiece starts to migrate out towards the periphery of the disc. The less cartilage we have here protecting or encasing that nucleus, the more chance we have of the pressure of that nucleus creating some sort of a bulge. And the reason why I drew that bulge in this area is that's the most common area that disc bulges happen. They usually happen right here where we have our spinal cord and we have the nerve root coming out from the spinal cord, and that nerve root is trapped in between the facet and the disc itself. At the most narrow portion that nerve root comes through is the most common area that a disc bulge is going to affect that nerve root. And what ends up happening is anytime that nerve root is irritated, we get a burning kind of pain going down the back of the leg. Common presentation of a disc injury is that it hurts to go forward or it hurts to lift my leg, but coming up is usually relieves the symptom. But either way, I usually have a burning kind of a pain going down the back of the leg. That's the most common representation. The other representation that's very common is a stabbing kind of a pain right in the midline of the back. And that pain is usually caused by these facet joints in the back portion of the spine getting compressed with each other. And the number one reason why these facets get compressed is because the disc itself, as it breaks down, it loses its structural height. Now remember, we talked that the discs are wedge-shaped so that it reduces that 40-degree angle to a 0-degree angle. Well, as the discs lose their height, as they break down and they wear out, the compressive forces start to compress these posterior facets together. Creates more friction, creates more binding, starts to generate pain. But even more importantly than that is we get a very serious mechanical fault. And what I mean by that is that, remember, this sacrum is at a 40-degree angle. Gravity wants to pull this lower structure forward into the abdominal cavity. So the most common presentation that happens is the disc starts to lose its integrity. It's allowing a little bit of play in that disc, which allows that vertebral body to start to shift off of center. And being on center is very important. It shifts off center, and what happens is the vertebral body drops forward. When that happens, these posterior joints lock in and they compress and they get stuck together. So it's almost like a wedge effect. These L4, L5 vertebrae drop forward, the back of the vertebra wedge in together, and those joints get jammed in together. Mechanically, that fault right there is the same thing as if I was standing like this. So even though I may be standing straight, structurally and mechanically, my low back is thrust into this position. So now it hurts for me to just stand. It hurts for me to just sit because my low back is stuck in that locked position. So the classic presentation of this is that I can bend forward relatively without pain, but it's the coming back up that hurts. Exactly opposite of a disc injury. Disc injury hurts bending forward. A facet injury feels good bending forward, but coming back up causes a lot of pain. And the reason why? Everything's already pushed forward and locked into that position. So even though I'm bending forward, mechanically my low back is in this position. Mechanically. Now let's give a comparison here on how we might want to treat this. If I went to my doctor for this syndrome, what would happen is I have two areas generating pain, sending pain signals up to the brain. I have the facets here jamming because there's a misalignment. I have torsion or stress on the disc, possibly even a disc bulge, generating some kind of a pain syndrome. So I have these signals going to the brain, telling the brain that there's pain. The only way the brain can respond to that is it's going to send back a spasm signal to all the muscles that attach to the spine, and it's going to make those muscles tighten up. And the reason why it does that is the brain works very simple. The only thing it can do if movement causes pain is to try to stop that movement. It's trying to create a splint or a cast by putting those muscles into spasm. So what happens is you go to the medical doctor, and he's going to give you 3 drugs. He's going to give you a pain reliever, an anti-inflammatory, and something to stop the muscle spasm. And so what he's doing is chemically he's trying to come in and he's trying to break these neurologic responses to this injury. If you let that go for a few weeks, eventually the pain will go away, but still you're going to have a hint that certain movements are still causing pain. And the reason why is the drugs did not take away that mechanical misposition, did not take away that mechanical fault. The problem, the cause of the injury, the cause of the pain is still there. All you did with the drugs is try to mask the symptom. Okay? We can approach that pain syndrome from a drug approach, or we can go to a doctor of chiropractic. we can go to somebody that specializes in resetting and putting these bones back on center. So usually I'm going to come in, when somebody presents to me, I'm going to evaluate what's going on. I have a battery of tests that I can do to determine which way the bones went off center, and then I'm going to figure out the best way to put those bones back on center. So I'm going to push those bones back into position. I'm going to realign that center line and restore that coupled motion. I now just reduced this mechanical misalignment that's causing all the problem.